Hi, I'm Nancy O'Neill. What does aging gracefully mean to you? Well, it means something different to everyone. No matter what age you may be, Aging Gracefully on Suncoast FYI offers advice that could help you live a healthier life. Each week we hear from a variety of specialists on a wide range of subjects. So please join us for Aging Gracefully on Suncoast FYI. For the next few weeks, Dr. Sessa will be going into depth on the topic of cosmetic breast surgery. He is here today to talk about breast augmentation. Welcome back, Doctor.
Thank you. Thanks for
So we're going to start the show with talking about what happens to our breast after childbirth. So
I see a lot of women for cosmetic breast surgery, and one of the main questions that I see, I hear a lot is in regards to childbearing and how long after and so on and so forth can they have surgery. So I'd like to just take a step back and just talk a little bit about what happens to your breasts during when you get pregnant and when you have your child. So, you know, when you get pregnant, you know, we have all these rush of hormones in our body that cause our breast to expand. It's a natural process, and it's a process that all women can look forward to, because I also hear, as an aside, I just want my breasts to go back to the size that they were. So when I was pregnant, not before I was pregnant. So the glandular tissue in your breast will hypertrophy and will expand in order to produce milk. And during that time, that's when your breasts will become engorged and enlarged. So as far as once you have the child and all of the hormones that were expanding your breast are now gone, now your breast starts to involute, it starts to decrease in size. All of the glands that were necessary to produce milk are now gone or shrinking. So what women all notice immediately is that the skin doesn't contract as quickly as the breast does. So unfortunately, we're left with a loose skin envelope, possibly stretch marks, and a smaller breast, maybe even a flat breast. And that what sort of, in and of itself, gets women to sort of come and see me.
Sure. So what do you recommend, and how soon after childbirth can someone receive breast augmentation?
So generally I tell people to wait at least 3 months, sometimes up to 6 months, after you've finished breastfeeding your child. Because if you're continuing to breastfeed, those hormones that are allowing your breast to produce milk and hypertrophy your glands are still in your body while the baby is still suckling. So once that stops and the baby is taken off of that and your breast is left to sit, your breast will involute fairly quickly, within the first month to 6 weeks generally. But you still may be able to express some milk from your nipple even up to 2 months afterwards. So we want that to pretty much stop, because we want to know if your breast is still somewhat enlarged and we put an implant in and then it still decreases in size, the result won't be what you were expecting. So I like to wait 3 to 6 months after you've finished breastfeeding your child to get the most accurate.
Now, before you become pregnant, is it safe to have implants? Or?
Oh, yeah.
Okay.
So, you know, the implants are foreign bodies. However, the implant is placed beneath your breast gland and also beneath the muscle below your breast gland. So if you look at, you know, anatomically, there are your ribs. Then above your ribs is your pectoralis muscle, which is the large muscle in your chest. Above that is a layer of fascia, very tight, that covers the muscle. Above that is a sort of loose, what we call areolar tissue, and then above that is your breast gland. So there's multiple layers. Generally, implants are placed in the loose areolar tissue below your gland, or under the muscle. So those are the two places that I place them. Most often I place them under the muscle because I think that it just gives a very natural look to the implant, as well as it's more protective to the implant. So as far as are implants safe, they are anatomically separated from your breast gland. And whether you get saline or silicone, they're not going to go into and around. They're sealed, and the way that the silicone is made now, it's very, very cohesive. So most, if not all, silicone implants now are almost like Jell-O. So even if you were to cut them or if it were to tear open, it's not going to leak out, and it's not going to get into the breast milk. So implants are safe before. They're not going to affect if you did have implants, got pregnant, and were breastfeeding. It's not an issue.
Okay. And you can talk to your patients when they come in to decide whether they want to go possibly a bit larger than they were before they had children.
Yeah.
So it all depends on the individual, and that would be the time to come in and do it, though, is the 6 months after.
Yeah,
Okay.
exactly. So the way that I like to do it, and I'll get into this a little bit more with some future segments, but I like the women to actually try on the implants because I like them to see what they're going to get, not that they have no idea what they're going to receive, and it's just a surprise when they wake up after the surgery's over, how much I actually put in.
Yeah.
So I generally I take measurements beforehand because implants are exacting, but they're not very exacting in terms of this is an object that will fit, but for a large woman that has broad chest, that size implant is going to look very different than a small petite woman.
Absolutely.
So trying the implants on is very, very important as far as what they're going to see.
All right. And we'll talk more about that, like you said, in upcoming segments.
Okay, great.
Thanks for being here today.
Thank you.
Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. We welcome back Dr. Terry Dees to continue our discussion on weight loss and how the customized weight loss program can help you keep weight off. Thank you for being back. Nice to see you again.
Nice to see you. Thank you for having me back.
Great. It's always good to start with a little foundation again. So can you tell us how you got started with your customized weight loss program?
Absolutely. Well, I've been in practice for 16 years, and I'm a natural health physician, so our focus has been clinical nutrition, functional medicine, chiropractic and rehabilitation, and my passion has always been weight loss. We ran a program over the last number of years where we always help people with getting healthier and doing it for the right reasons, for long-term health benefits. Because, you know, when people are just trying to get healthy, to look better in a bikini or something like that, it gets hard to maintain it for the long term. And we've really focused in on our customized weight loss plan over the last year.
Okay. Now, and it's about making small life changes and gradual things. Can you give us an example of what someone's customized program might look like?
Absolutely. So a typical patient for us is someone who's done a big box plan in the past. They've lost some weight, they've gained it all back. It's someone that wants to lose the weight quickly, naturally, in a very healthy way, and learn how to reset their metabolism to maintain it for the long term. So it's funny because people will call my office and speak to my assistant and say, well, can you tell me about the details of the program and how it works? And it truly is customized for each person, because what you might need for your health is completely different from what the next person needs. So we focus on whole food nutrition. We sit down knee to knee, eye to eye, and figure out where they are with their health, what high-grade nutraceuticals would benefit them to help support their body systems, to put their health in the best position possible, to help their body burn fat in the fastest way, the healthiest way. And we average men typically typically lose about a pound a day, and women lose anywhere about half a pound to a pound a day.
That's amazing.
It's incredible.
That's amazing.
And our demographic we work with most commonly is 65 to 85. So we're doing this with people, you know, not 30-year-olds that have super high revved metabolisms
Right.
and great hormones. So we're addressing hormonal issues, we're addressing metabolism issues, we're addressing thyroid, we're addressing detox, and we're creating a custom plan to help those people without drugs, without surgery, without exercise, get to a better level of health. And then I think it's as important for people to get the weight off as it is to learn how to reset their metabolism to keep it off.
Absolutely.
Because especially as you get older, the more you yo-yo up and down with your weight, the harder it becomes on your health.
Absolutely. There's a lot of health problems that it causes. I know. I've been there, and I think we've both talked about it, that we've both lost a significant amount of weight, and that's not anything that you want to see as we grow older.
Oh,
okay?
yeah. And it's hard on you emotionally, too. If
Yeah.
you've lost the weight and you got back into the little clothes, and then all of a sudden you're creeping up your sizes of clothes, you know, we build into our program a back end of lifetime support. So if things start to go south, you know, I tell our patients, you gain back 5 to 10 pounds, you call me right away.
Absolutely.
And we'll have a come to Jesus meeting and we'll figure out how to course correct.
Yeah.
Because 5 to 10, if you catch it, you can course correct. It starts going 15, 20, 25, 30 with people, you know, 60, 70. Well, then we got to start over from the beginning.
Yeah.
And that gets tougher and tougher as you
Yes.
get older.
It does. Now, is there anything on your program that someone is not allowed to have?
Yeah, and that varies from person to person.
Okay.
So, you know, it truly is customized of how we set things out. And knowing where people start with their health, what they've got going on, really helps a lot to customize that plan for every person. So, you know, there are probably 80% of people fall into a typical plan, but there's always those exceptions that we have to, you know, work with to help them get the results that they want to get.
Okay, so again, now, for example, I enjoy a glass of wine. Is it something that I can have on the program, or is it something that maybe later on in the program I
Yes.
can incorporate back into it?
That's an excellent question. I find in this part of Florida, wine is like an extra food group. You know? So that's a question we get a lot from people. Typically, I give people the lowest sugar cocktail that you can make that won't you know, affect your metabolism and keeps your insulin very stable. So initially, when we're trying to, we call it a rehab phase, trying to really lose the weight, that we limit the alcohol in that phase. But as we move on to the later stages is where we can introduce, so that eventually we get to the point for people when they're in a maintenance phase, that 80% of the time they're eating a healthy diet, 20% of the time they're enjoying their life with food.
Awesome.
So they have that as a flexibility.
Okay, so that's basically how you help people incorporate into how to keep the weight off once they've lost it.
Exactly. Yes, we do a structured plan to get the weight off and can do it very quickly, very healthy, and then teach how to maintain and reintroduce so you don't regain.
Okay, and I understand you have another success story that you'd like to share with us today.
This is a lady, Lori, that we worked with. Great lady, you know, busy in the workforce and didn't have a lot of extra time to pour into training and different things to try and get fit. She lost almost 20 pounds in 40 days, a huge amount of body fat. You can just tell in her photos that just the definition that came back was great. And we did it without exercise. 80% of your fitness is nutrition. And she's done phenomenally well. And her friends and her coworkers are just dazzled by her success. And we're
I'm sure
super proud of her.
very inspiring. Very inspiring story. Now, you have something special for our viewers again today. Tell us about what this special offer is.
Yes, we want to give the viewers an opportunity that if you want to sit down to have a conversation about if our program could be a good fit for you, we want to give you that opportunity to do that. So we're going to give a chance for the first 20 callers. We did you know, more than that in the past, but we're very busy, so I have to limit down the number.
Great.
But the first 20 callers that we do a free, no obligation consultation.
Okay, that's great. Please take advantage of this. If you've ever wondered what the customized weight loss program is, this is the time to do it. So thank you so much for being here again. Nice to see you as always.
Nice to see you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break. Toya Crutchfield returns this week to talk more about her outpatient physical therapy clinic, Therapeutic Lifestyle Solutions. Welcome back, Toya.
Thank you, Nancy. It's wonderful to be here again.
So today we're going to, as you say, wrap up kind of what we've been talking about for the last several weeks.
Yes.
So tell our viewers what sets your Therapeutic Lifestyle Solutions Center apart from others.
Our clinic is a very unique clinic in that we're very much patient-oriented. We're all about the patient. Oftentimes in outpatient settings, because of the way that insurance dictates care for most of us in healthcare nowadays, it becomes more of a business, obviously, worrying about the claims being processed and all of that. For us, of course, we're a business. Of course, we have those same concerns.
Absolutely.
But more than anything else, it's about giving the patient a center that they enjoy coming to, that they can feel relaxed and be assured that everything, every concern they have, every problem they have will be addressed. And it's all about how their care can take them to the very next level, not just move them in, move them out kind of thing like you see in a lot of centers.
No, I mean you become, very close to your patients.
Absolutely.
I mean you want them to succeed, because if they're not happy, you're not happy, and they're going to not tell their friends
Exactly.
to come and see you, right?
Exactly.
So you've got a lot of things that you do there. What is most unique, would you say, about Therapeutic Care Solutions?
Therapeutic Lifestyle Solutions really is the uniqueness, I think, is within all of us. Everybody that's a staff member there. Everything that we've put together are tools that will give a patient the clinical outcomes that they're looking for. And we're constantly reassessing that to make sure that the patient is meeting their goals. Because at the end of the day, like you said a minute ago, that's really all that matters, that a person is able to meet their goals and return to their life. We like to think that our patients start as a patient, but they leave as a friend, and they leave as someone able to return to their prior level of function.
Okay. Now, how do you establish a clinical plan for each patient?
That's a really great question. A clinical plan of care is probably one of the most important elements of getting a person involved in physical therapy. So when a person knows that they need to come for physical therapy, either their doctor has referred them for physical therapy, or they've had experience with physical therapy before and they know that it can be something that can help them meet their goals. They have to come in for either a free assessment that we do in the beginning to make sure that they're appropriate for our program, because as you know, in everything we've talked about in all the segments, we have very specialized programs, but we're also a clinic that can deal with your basic orthopedic and neurological issues. But when they come in, we do what's called an initial evaluation. And that initial evaluation is something that I personally spend anywhere from an hour and a half to an hour and 45 minutes doing, because it's so important for me to completely understand what is going on with that patient. And so often in healthcare now, as you know, you may get 5 minutes with your doctor, you may get 20 minutes with your therapist, or you're immediately turned over to another staff member within the clinic. That's another thing that sets us apart. We don't do it that way. I make sure that I completely understand what's going on with them, everything to do with their past medical history that is pertinent to their current situation. Oftentimes patients just need someone to listen to them, and to really feel that the person is compassionate enough to do whatever it takes to help them meet their goals. It's their therapy. We're just there to help, help them provide the tools that they need, the education that they need. I think you and I have talked before. I'm very big on education, because if you don't understand all of these fancy tests that you've had and the results of those, you know, you hear these big words, you don't really understand what's going on, it's very difficult for you to really do your part, because you have responsibility as well. The patient will always have a responsibility in getting themselves better and meeting their goals.
And that's, again, it comes down to communication. I mean,
it.
you're going to sit with them. If I feel rushed when I come in to see you, I'm going to forget possibly what I wanted to ask you. I'm not
Exactly.
going to feel comfortable like asking you things, feeling that, oh my gosh, I'm taking up too much of your time. And that's totally the wrong way to feel. And I know
Absolutely.
you don't make your patients feel like that. And again, you want to know what they need from you
Right.
in order to
Right.
be able to help them.
Right. So often too, you know, when people are going through all kinds of different issues that may bring them in for physical therapy, they don't realize our body's a chain. So
Sure.
anything that goes wrong within that chain is going to affect everything else. So ultimately, someone that may come in with a knee issue may also be someone who is very limited with their back or their hip. So if you don't address that whole person, not just that knee, you're going to miss the boat.
Okay. Now, how do you measure the success once they've come in? And as they're going along in their treatment, do you tell them, you know, you've got so much more percentage of what you did when you came in? I mean, how do you give them, you know, the confidence to see that they're going forward?
That's so important also. You know, as you're going along in life, in physical therapy and whatever the case may be, the validation of knowing that you're doing the things that you need to do is so important. The first thing I ask a patient when they come back after every treatment is, how did you do after your last treatment? It's so important to understand how that patient responds, because there's a million things we can give them to do, a million things we can do within the clinic, but you need to know how that patient is responding. So as they're responding well and they're feeling better, you're looking at their pain levels, you're looking at their functional status, how much that's changing. You're constantly discussing that with them. And then Medicare also makes us do a progress note every 10th visit, which is so important too.
Okay. So how does one person begin physical therapy with you?
To begin physical therapy in any outpatient center, you're going to need at some point a doctor's order.
Sure.
Next week, my front office manager, Jamison Brown, who's very much an expert in this whole thing, and that's where it starts. He's going to come in, he's going to discuss that in great detail with you.
Awesome. Well, thank you again, and I
Thank
look
you.
forward to speaking with Jamison next week.
Thank you, I can't wait either.
Thank you.